Regarding gram-negative bacteria, now we discuss the gram-negative, which are curved rods. So in the curved rod category, we have three bacteria: Campylobacter, and then we have Vibrio Cholerae, and also H. pylori. So we have known from our gram-negative algorithm that the curved rods are in shape; they are curved, and also they are oxidase positive. So we will discuss the specific feature of these three pathogens. So the first one is Campylobacter, and Campylobacter we have known Campylobacter is gram negative. It is rod, curve shaped, and also it is oxidase positive. So the important feature related to this that it can grow at extreme temperature. With Campylobacter, the route of transmission is fecal-oral, and fecal-oral through person to person, through person to person transmission. Also, fecal-oral ingestion of undercooked meat, undercooked poultry, and also undercooked or unpasteurized milk. And the most important or very frequently the frequent clue regarding the transmission is uh, direct contact with the infected pets, especially the dog, pig, or the cat. So in the scenario, they have given us the clue that recently the family adopted a pet imported from some area, rural area. So the pet is very much infected. So in the direct contact of that infected pet, the child is now suffering from diarrhea. So the symptoms are very much obvious. There is a fever, bacterial infection, so there is a fever, and also we have crampy abdominal pain. And first the diarrhea is mucus related, then eventually it progresses into bloody diarrhea. So there is a bloody diarrhea. It means that the blood contains RBCs and it is inflammation, so there are a lot of WBCs also. So in the majority of the patients, majority means the immunocompetent patients, they get resolved, they resolve from this infection. But if the person is old, immunocompromised, and these are minority patient, a small population of the patient, old, immunocompromised, the person having comorbids, and also suffering from all another diseases, especially the debilitating illnesses, then the person is eventually goes into Guillain-Barré syndrome or reactive arthritis. Yes, reactive arthritis. um the pathogen reactive arthritis has the etiology of Campylobacter, because Campylobacter can cause reactive arthritis, because Campylobacter in the Guillain-Barré there is a molecular mimicry, immune molecular mimicry, but and also in the reactive arthritis there is also immune related issue. So that's why reactive arthritis, the one or two questions are arises from reactive arthritis. I have seen Campylobacter in the etiology of reactive arthritis. So pretty much low yield, but not much frequent, but can be testable in reactive arthritis etiology, Campylobacter. So the next bacteria, up till now we have discussed all the important features of Campylobacter. Now we discuss Vibrio Cholerae. Vibrio Cholerae, gram negative, oxidase positive, but Campylobacteria and important feature is alkaline media growth, can be grown in alkaline media. Alkaline media growth means if it is acid sensitive or acid labile. So if the person is healthy, okay, it's his stomach is making a good amount of acidic environment, then there is the very less chances of infection of this Vibrio Cholerae. And in the it is acid labile, it means that there must be large infectious dose of this bacteria in order to cause infection. Infectious dose mean that we will discuss in later on in the salmonella section, but for now we have a general idea that infectious dose mean the dose of the infectious pathogen which cause a particular infection. So when a patient is immunocompetent and his stomach is working well, then there must be a large infectious dose needed in order to cause cholera infection. But if the person is acholeric choleridia, or the person is on peptic proton pump inhibitors, or the person having any surgery related problem, the surgery regarding the acholeridia, in the acholeridia there are a lot of etiologies, a lot of causes of acholeridia. So generally if the person is acholeridia, then a small infectious dose can cause Vibrio cholera. And in the cholera, what the pathophysiology, we have known that the cholera toxin causes this Vibrio cholera. The cholera toxin, we have discussed this in our toxin lectures, that the cholera toxin persistently stimulate the G stimulatory subunit of protein, and which causes the persistent activation of adenyl cyclase, which leads to the increased secretion of chloride and increased efflux of water, which leads to increased fluid excretion. So cholera toxin do this. The symptoms is profuse or voluminous rice water diarrhea, and it is very much common in the developing countries where the water sanitation purification system is not good, because the route of transmission is contaminated water and also undercooked shellfish. So this is how Vibrio cholera do this profuse watery diarrhea. So the treatment of choice is only supportive, replace the fluid loss, mean aggressive hydration. And this is all about Vibrio cholera. The next and the last curve broad bacteria is Helicobacter Pylori. We have known Helicobacter is gram negative, oxidase positive, and also it is a motile curve rod. So there is a little more information that Helicobacter is triple positive, mean it is catalase positive, it is urease positive, and it is also we known that it is oxidase positive. Urease positive mean we can diagnose it by the urea breath test, and also we can do antigen test fecal antigen test. Helicobacter attacks the antral part of the stomach, and which leads to causing gastritis. Also, it can causes duodenal ulcer under the category of peptic ulcer disease. Also, it causes gastric adenocarcinoma and mild lymphoma. Then we have the treatment for this Helicobacter pylori. That the treatment is very much typical. So the most common initial therapy for this is a antibodies cure pylori, mean antibody A for amoxicillin. And if the person is allergic to amoxicillin, we give him metronidazole. C for macrolides or calithromycin. But if the person is resistant to calithromycin, we switch to bismuth therapy. And P for obviously our favorite proton pump inhibitor, omeprazole. So this is the treatment of choice for Helicobacter pylori. And triple positivity, urea breath test. Urea breath test is it converts ammonia into ammonium in order to survive in an acid environment of the gastric. So these are the three important gram negative, oxidase positive curved rods. Next we will discuss all the bacteria regarding the bacilli and